As far as a layman is concerned or general practitioner is concerned, they know about serum creatinine level.
Yes.
They check about the urine output, or they check about the face swelling or the
Yes.
body swelling. But are there any other tests to diagnose kidney failure in early stage?
That's a very good question because, like we know that serum creatinine, it increases once your 50% of kidney function is already compromised.
Okay.
So before that, we need to diagnose because till that time already we have lost some function. So one of the things that we talk about is urine routine and urine protein creatinine ratio. So urine routine is like the it's the window to the kidney. So here we get to know whether the kidney is appropriately concentrating the urine or it's a dilute urine. We get to know whether there is loss of certain amount of protein in the form of albumin, and whether there is loss of certain blood cells which are not supposed to be there. So these things are picked up in the urine analysis, and when we quantify that we call as urine protein creatinine ratio or urine albumin creatinine ratio, so where we are quantifying the amount of protein loss. So this is also significant because the more it is, the more severe the damage is. So when I was speaking about glomerular diseases, so it can be as high as 3.5 grams per day loss of protein, and early stages it can be as low as 30 to 300 milligrams per day. So this is where we pick up. So creatinine has not increased, but proteinuria or presence of any active sediments in the urine, this means that damage has started. We have to catch the patients at that level.
Okay, so in which patients do you recommend a detailed study of kidney functions?
Okay. So first of all, I would say that the most important thing that we all should do is routine health checkups, because here we pick up something, some smallest abnormalities in the urine or creatinine. So those patients who we find early changes in the urine, like presence of blood in the urine, presence of protein loss, that is protein 1 plus, 2 plus, 3 plus, that's there in the urine. So these patients are the one that need detailed examination. So if we miss them, what will happen is once the creatinine may be normal, but if we miss them, then we may not detect it early and we may have loss of kidney function. So these patients require, apart from that, any diabetic should get a kidney function test every yearly, at least every year, even though if everything, your sugar is under control. Because what we have seen is it's not just the sugar control, it is the duration of the disease. So anyone who is 5 years plus diabetic should have kidney function tested every yearly. There is something called as diabetic nephropathy that we talk about in diabetic patients, where it begins with frothy urine, like the patient will complain of presence of bubbles in the urine. So this is a very minor symptom, it may not cause you any other problem, but this is something that you notice. So this is the early thing that we need to check. So all the diabetics should get kidney function test.
So we'll come to the diagnosis. How to diagnose kidney failure?
Right. So we discussed the normal routine test that we do for kidney, detecting kidney disease, which is kidney function test, complete renal function test, along with the urine tests. Apart from that, there are special tests. Some of them are blood related, some of are diagnostic intervention related. So what I want to talk about is kidney biopsy, which is a small sonography based procedure. It is done by nephrologist as well as interventional radiologist, where we take very small tissue, kidney tissue, and we see it under the microscope. So this will help us in seeing what are the structural changes inside the filtering unit of the kidney, and presence of certain things that we see in the biopsy. They help in diagnosing the condition, and the treatment varies with it. Apart from kidney biopsy, we have certain blood tests that I was talking about, which will include a autoimmune panel, where we do ANA, dsDNA, C3, C4, ANCA levels, plateau R levels. So these are certain blood tests related to glomerular diseases. And of course, very important is 24-hour urine protein estimation, where if we see that there is loss of protein from the kidney, we need to estimate in a day how much the patient is losing, and based on that the treatment will differ. So diagnosis per se is rather simple, but treatment is elaborate depending on what what the patient has and what we are treating.
Yeah, so as far as kidney biopsy is concerned, being an interventional radiologist, I have come across few procedures where we are putting a needle into kidney for the sampling, but we also explain to the patient that there is a chance of bleeding during
Yes.
kidney biopsy. So patient gets
Scared.
frightened, scared that if bleeding occurs more, then there is a risk of life, risk of removing kidney and all. So, but we also try to explain patient that this kidney is must, like this is very important for the diagnosis. So why kidney biopsy is so important that without doing it we cannot proceed further?
Right, very good question, because this is true. This is a very clinical based scenario where the patient gets very scared. First of all, let me tell you, 99% of the kidney biopsies are without any complications.
Okay.
So the complications that happen, see, any small injection also you take, they'll be having some complication is associated with any procedure. With kidney biopsy, why we are so cautious is because kidney is made up of filters, and these filters are blood vessels. So when we poke a needle, there is a chance of bleeding. Now, 90% of the time, there will be no obvious bleeding which is noted in the urine. 10% of 9% of the time, it may happen, that the urine may appear red initially, and as we see the serial urine samples, it will be better. 1% of patients may have requirement of blood transfusion if the bleeding is more, and very, very slight 0.1 to 0.3% of cases may require surgical intervention for controlling that amount of bleeding. Now, if we don't do this biopsy, we are not sure what exactly is the kidney problem, so, which is very common. Like even in diabetic patient, although I'm suspecting it's a diabetic nephropathy, but if the protein loss is very, very high, 10 grams, 12 grams, I need to see whether it is associated with something called as membranous nephropathy, which is a type of glomerular disease. So the treatment totally varies. So membranous nephropathy is a treatable condition. I can give rituximab. There are certain options that I can use, and it can cure it. Whereas with diabetic nephropathy, I have certain drugs only to control the protein loss, but not beyond that. So it will change the course of your treatment as well as your prognosis. And if certain conditions like glomerular diseases are not diagnosed by biopsy and treatment is not given, within a few years there will be stage 5 kidney failure and you will need dialysis. So that is why biopsy makes a very, very important part of our diagnostic thing.
So kidney biopsy is very good diagnostic test which can decide the further treatment plan, and there is definitely chances of bleeding during kidney biopsy. But we have option of giving some medications initially, then
Pressure.
if required blood transfusion, and then if required surgical treatment. Now in surgical treatment also, it's not needed that we'll be removing part of the kidney. So there is a procedure called as embolization, where we can go from the groin or from the hand, we go into the artery which is bleeding, and we can put a small coil there to stop the bleeding. So as the rest of the kidney function is preserved, and we can proceed with the existing kidney function, and we will be having diagnosis in our hand. So kidney biopsy is very important diagnostic test. Patient should take some precautions, like if patient is on any blood thinner medicine, we need to stop those medicines 5 days prior to the procedure. We usually ask patient to lie down in the same position for 6 hours. We take 3 samples of urine where we see if there is a blood into urine, and if there is a hematuria, pain, or any other signs like hypotension, tachycardia, we diagnose further.
And immediate intervention is done.
Yes, so we can stop that bleeding and we can save patient's kidney. So this is part of the diagnosis for the kidney failure.